Hi everyone. Today in this video we are going to discuss about Tizanidine. What is this drug Tizanidine? Just like clonidine, Tizanidine is a centrally acting alpha-2 adrenergic receptor agonist. So this drug acts on the presynaptic motor neurons and it acts as agonist, but it is going to inhibit the release of neurotransmitters such as glutamate. Thereby, it can reduce the motor neuron activity. That's why Tizanidine is used in the muscle spasticity, particularly spasticity associated with any brain injury or spinal cord injury. In such conditions, Tizanidine can be used, which acts centrally to control the motor activity. So today in this video, we are going to discuss how this Tizanidine acts, what is the mechanism of action, what are the important precautions, side effects, chemical nature and dosage of this drug. All these things we will discuss in this video. First of all, let us see the chemical nature of this drug. So this is the structure of Tizanidine. Here it is having 6+5 heterocyclic ring system. So let us give the numbering. So this is 1, 2, 3, 4, 5, 6, 7. Now sulfur is present at second position and nitrogens are present at first and third position. And this 5-member ring system is fused with benzene. So it is a benzothiazole. But the positions of sulfur as well as nitrogen are located at second, first and third position. So it is a 2,1,3 benzothiazole ring system, which is having an amine group at the fourth position. So you can write this as 2,1,3 benzothiazole 4-amine. That is a ring system present in Tizanidine. Now fifth position is having a chlorine group, so 5-chloro. On the amine group, it is having one side chain, which is nothing but the imidazole ring system. And this imidazole ring system is attached by second position, so we can write this as N-1H imidazole 2I. But this imidazole is partially saturated at the fourth and fifth position, so 4,5-dihydro. That is the complete name of Tizanidine. Now let us see how this drug acts. Centrally, presynaptic neurons are loaded with neurotransmitters such as glutamate. Glutamate is an excitatory amino acid neurotransmitter. Now this glutamate can act on the motor neurons, which are expressed with glutamate receptors such as AMPA. AMPA is a fast-acting glutamate receptor. Similarly, if you have the presynaptic neurons carry another type of mediator such as GABA, which is an inhibitory neurotransmitter. Now, this GABA can act on the GABA receptors. Again, the receptors for GABA are expressed on motor neuron. For instance, GABA A receptors are expressed on motor neurons, which are inotropic receptors. And similarly, GABA B receptors are also expressed, which are G protein coupled receptors. Now, when the action potential reaches to the presynaptic neurons, the glutamate can be released and it can act on AMP receptors so that the sodium channels are opened and sodium can enter to produce excitation within the motor neuron. Now, this excitation is going to be carried to the skeletal muscle where it produces the contraction of the skeletal muscle. In this way, glutamate is an excitatory neurotransmitter which can increase the muscle contraction. But this muscle contraction can be controlled in several ways. Within the presynaptic neurons, alpha-2 receptors are present, which are activated by sympathetic mediators such as norepinephrine. So when the norepinephrine acts on these alpha-2 receptors, they are activated and they are inhibitory in nature. They can inhibit the release of glutamate so that glutamate is not released and muscle contraction is going to be controlled. Similarly, GABA is another inhibitory neurotransmitter which can directly inhibit the motor neuron activity. It can bind to the GABA B receptors so that motor activity is going to be reduced. It can also act on the GABA A receptors which opens the chloride channels so that it produces hyperpolarization and inhibition of motor neuron activity. In this way, the muscle contraction is controlled in several ways. So here Tizanidine is one of the drug which acts as alpha-2 receptor agonist. So this drug can bind to these alpha-2 receptors, thereby it can produce inhibition so that the glutamate cannot be released properly, which inhibits the motor neuron activity. In this way, Tizanidine can reduce the muscle spasticity by acting centrally on alpha 2 receptors. What are the precautions of tizanidine? Tizanidine, just like the clonidine, it is a alpha 2 receptor agonist. Clonidine is used as antihypertensive agent as it reduces the blood pressure. Similarly, tizanidine can also reduce the blood pressure and it can produce hypotension in the patients. This hypotension may lead to some syncope, the fainting sensation in the patients, and this effect is mainly due to action on alpha 2 receptors. That's why tizanidine should be started at low dose in order to reduce the hypotension as well as syncope in the patients. Similarly, this drug can increase the drowsiness as well as sedation in the patients. Since this drug acts centrally, it can increase the sedation. This is particularly more important when this drug is given along with alcohol. Otherwise, with other drugs such as benzodiazepines, TCS, tricyclic antidepressants, opioids, all these drugs are CNS depressants. So when these CNS depressants are combined with tizanidine, they can further increase the sedation and drowsiness, which is more significant in this combination. That's why these drugs should be avoided along with this tizanidine. Similarly, this drug can produce some hepatocellular liver injury. So it can increase the liver enzymes such as ALT levels, alanine transaminase levels, and AST, aspartate transaminase levels may be elevated. And this liver abnormality can be observed after 1 month of treatment with tizanidine. So care should be taken when this drug is prescribed for greater than 1 month in the patients, and liver functionality test should be done in order to assess any development of liver dysfunction. Another important precaution is that this drug can produce some hallucinations in the patients. So it can produce some psychotic symptoms such as hallucinations, delusions, which should be carefully monitored. This drug is going to be converted into metabolites by cytochrome P450 system. Among them, CYP1A2 is one of the important enzyme. So few of the drugs such as ciprofloxacin, fluoxamine, xylitol, similarly other drugs like cimetidine, imidazole, oral contraceptives, all these drugs are the strong inhibitors of CYP1A2 enzyme. So when these drugs are combined with tizanidine, they can increase levels of this drug, which leads to severe hypotension, hallucinations, and drowsiness in the patients. So care should be taken when these drugs are combined with tizanidine, and the dose should be adjusted based on the symptoms in the patients. Finally, tizanidine can also produce hypersensitive reactions such as anaphylaxis, angioedema. It can produce some swelling of lips and tongue. Even it can produce urticaria. And in the patients with any renal insufficiency, this tizanidine should be used at low dose in order to prevent any hypotension and sedation in the patients. What are the side effects? The important side effects mainly include dry mouth, drowsiness, constipation, somnolence, the sleepiness in the patients, asthenia, lack of energy, some nervousness can be observed. Similarly, it can produce hypotension, bradycardia, some blurred vision, flu-like symptoms such as rhinitis, pharyngitis, and some hypersensitive reactions such as skin rashes can be observed with this tizanidine. How it is given? This drug is available as tablet at a strength of 4 mg and is also available as capsule at different strengths such as 2 mg, 4 mg, and 6 mg. Both tablet and capsule are not bioequivalent in their pharmacokinetics when they are given along with the food, but on empty stomach they release the drug in a similar way, and the initial dose of the drug is started at very low dose. So this drug is started at 2 mg given for every 6 to 8 hours. So maximum it can be given 3 times a day with a gap of around 6 to 8 hours. And the dose can also be increased up to 4 mg. Again, it is given for every 6 to 8 hours. But the maximum dose of this drug should not be exceeded greater than 36 mg per day. So based on the efficacy, the dose should be increased. And in the patients with any renal insufficiency or patients with significant sedation and hypotension, the dose should be reduced. So that's about this drug tizanidine, which is a centrally acting alpha 2 receptor agonist. This drug just acts like clonidine. Sedation, drowsiness, hypotension are the important side effects produced by tizanidine. And it can also produce some liver injury, so care should be taken when this drug is prescribed for greater than 1 month. So that's about this tizanidine. That's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.